Hall. The state health department has confirmed the second measles death both in the state and on the South Plains. An 8-year-old girl from Seminole died this week. According to the Texas Department of State Health Services, the child was receiving treatment for measles at a Lubbock hospital. She died Thursday. The state reports her death was caused by measles pulmonary failure, adding she was not vaccinated for the virus and had no reported underlying conditions. Robert F. Kennedy Jr., the U.S. Secretary of Health and Human Services, was in Gaines County for the child's funeral today. Kennedy posted to social media afterward, saying his intention was to be with the community in their moment of grief. He also said his visit was to support Texas health officials and learn how HHS agencies can better partner with them to control the outbreak. Kennedy also said he redeployed CDC teams to Texas to help supply MMR vaccines and support local agencies battling the virus's spread. There are currently 481 confirmed cases of measles in Texas, according to the state health department. Of those 481 cases, 441 are in West Texas, 421 of which are specifically on the South Plains. There were only 285 cases across the country total in 2024. Gaines County, where the child who died was infected, continues to lead the infection count. The state reports 315 cases there, which accounts for 65% of the outbreak. According to the health department, 97% of those infected were unvaccinated or whose vaccination status was unknown. 3 people who received 1 dose of the MMR vaccine. 7 people received both doses. Most of the measles infections are in children between the ages of 5 and 17. The other age group with the second highest amount of infections is children and infants 0 to 4 years of age. We're also learning more tonight about a measles exposure at a Lubbock daycare. NBC News reports 6 children at Tiny Tots U near 137th and University tested positive for the virus within the past 2 weeks. Lubbock Public Health reports the exposures began Monday. We did reach out to the daycare to confirm the exposure count and to ask how it's controlling the spread. We have not yet heard back. The CDC recommends the MMR vaccine for children 12 months or older. However, in special circumstances like an outbreak, children can receive the shot at 6 months. In New Mexico, health officials there confirmed 6 new cases since last Tuesday, all in Lee County. Of the 54 total cases across the state, 52 are there. There are also 2 cases in Eddy County. 36 of those diagnosed with the virus were not vaccinated, and the majority of the cases there are in adults. Health officials continue to reiterate that the best protection against measles is the MMR vaccine. They say this is especially important amid reports of vitamin A toxicity in children here on the South Plains. The use of vitamin A as an at-home measles treatment is a claim that has circulated social media since the outbreak began. Robert F. Kennedy Jr. also directed the CDC to update measles guidance to promote the vitamin's use. Now, however, Covenant Health reported to Texas Public Radio that it's seeing an increase in young patients with toxic levels in their system. According to the Texas Public Radio report, Covenant confirmed 10 pediatric patients were seen with elevated levels of vitamin A and abnormal liver functions. While the vitamin does support immune functions, health officials say it will not help cure or prevent measles. Consuming too much of the vitamin can cause liver damage, among other unwanted side effects. Secretary Kennedy did today also affirm that the MMR vaccine is the most effective way to prevent the spread.